So welcome everyone. I'm Ariel Kane, PPI's Director of Healthcare Policy. I have today here an amazing panel to talk about living with COVID-19 in 2022. There's consensus that COVID-19 will become endemic, but we aren't quite there yet. Hospitals are still overrun. We still need to wear masks to protect ourselves and others, and we haven't vaccinated enough people to have herd immunity. So how do we best live with the virus, both today and in the future? Today, I've brought together a truly amazing panel of experts to discuss this issue, and I wanted to start off by briefly introducing everyone, and then we'll jump into the discussion. First up, we have Congresswoman Lori Trahan. She represents Massachusetts 3rd District. And when the coronavirus pandemic first hit in March 2020, she worked to secure hundreds of millions of dollars in federal relief funding to keep workers and businesses afloat, ensure that hospitals and health centers remained open, and shorten the Commonwealth's road to recovery. Now, she is a co-founder of the Pandemic Preparedness Caucus and is working to end the United States dependence on a foreign supply chain for essential PPE. Welcome, Congresswoman.
Thank you for having me. And it's great to be a part of such an impressive panel of experts. It's such an important discussion about living with COVID-19 in 22 and beyond. Look, when this pandemic started 2 years ago, most Americans believed we'd hit the pause button for a couple of weeks, maybe a month, while we got this virus under control and then returned to normal. But the fact of the matter is that this virus demonstrated just how unprepared we were as a nation for a global pandemic. Emergency workers like nurses and doctors, EMS and police officers, public health workers, they were forced to MacGyver it, frankly, at work every day while they worked to save lives. Some had to reuse the same disposable masks for days in a row until the strap broke or the front frayed too much. Others had to cut holes in a trash bag to wear instead of a gown. So surge after surge, case after case, we've managed to improve our ability to respond to this virus. Hospitals now have better systems in place to deal with positive patients. Schools have stronger protocols to stay open and to keep our kids and our educators safe. And with the creation and distribution of the vaccine, we've begun down the road to establishing our new normal with COVID-19, but one where we can be protected from it if we all do our part. And I think that's exactly why legislation like the American Rescue Plan was so important. Not only did it get much needed relief to families and small businesses struggling to make ends meet, but it also played a pivotal role in getting shots into arms. So I look forward to this conversations about what the new normal is, what restrictions are too burdensome and which ones are practical safety measures that keep people safe are really important. And there's no question we still have a ways to go as we continue working to recover from this pandemic. But conversations like the one we'll have today are key to ensuring that we're taking the appropriate actions to get us there as quickly and as safely as possible. So thank you for having me.
Thank you, Congresswoman. Next up, we have Dr. Leana Wen. She is an emergency room physician and public health professor at George Washington University. She is also a CNN medical analyst and a contributing columnist for the Washington Post, where she writes and anchors the Post newsletter, The Checkup with Dr. Wen. Previously, she served as Baltimore's health commissioner, and her new book is Lifelines, A Doctor's Journey in the Fight for Public Health. Thank you so much for being here, Dr. Wen.
Thank you, Ariel, for convening us, and thank you all for this important conversation, which I think is one that is very timely right now. I actually wrote my Washington Post column last week on this topic and specifically saying that as a country, we need to decide which direction we're going, as in I think that there are two paths for us at this point. One is continuing down the path that we are already on, which is mainly focusing on infection control. And look, there's a reason why we do this, right? We want to reduce infections, we want to reduce hospitalizations and deaths. If we continue to do vaccinations and have high quality masks and ramp up testing, ideally we get to the point that we suppress the level of infection low enough that we're able to then test, contact trace, isolate, quarantine, get COVID under control. That's one path, and it certainly has many positives in that we are focusing on saving lives. But the downside is that it keeps us in this mode of essentially being in pandemic preparedness and response for the indefinite future. And I think there are many people, including those who are vaccinated, who are now saying, I don't want any more restrictions on my life. I've done my part. If I'm vaccinated and boosted, my individual risk of getting severely ill is very low. And so why do I still want to live in this perpetual pandemic mode? There's another path that we can go down as well. And that path actually is what some European countries, including the UK most notably, have gone down, which is to say that at this point, we are going to value more than anything a return to normal, as in no more disruptions to society. We may even decide over time, if you go down this path, that you don't even want to test except for those who are high risk, who then need to be in treatment. But maybe we don't even need isolation and quarantine anymore, which would relieve a lot of shortages in the workforce. But the downside is we could still have a very high level of infection and transmission that could lead to more deaths, but at the same time, there would be more of a return to normal. And I guess my point is, at this point, in this pandemic, we have to accept that we're going to be living with COVID. What does that look like is actually not a scientific answer, as much as it is a policy and political answer. As in, we in science can't tell people what you value. Is the value going to be we prioritize infection control above all else? Or is the value that we want society to move on above all else? That's the decision ahead of us.
Thank you so much for that. That was such a good way of framing it. And then next up, we have Rekha Lakshmanan. She is a contributing expert for the Center for Health and Biosciences and Director of Policy at the Immunization Partnership in Houston. Her work involves developing and implementing public policy strategies to improve vaccination rates in Texas, advising other states and organizations on building grassroots networks, and teaching constituents how to communicate with lawmakers. Thank you for being here, Rekha.
Hi, thank you so much. And it's a wonderful opportunity and an honor to be with such a distinguished panel of experts. As we are kind of going through, the pandemic and, really trying to fervently get to the other side, my perspective is a little bit unique because I am in the States. And, I hear from, individuals every single day about, their concerns and their worries and their struggles about getting vaccinated, whether or not that's the right thing that they should do. How do they talk to their friends and their family and their coworkers, but then also taking it one step ahead, which is having those same kinds of conversations with lawmakers to ensure that we've got the right policies in place at the state to affect the broadest population. And, it's been really some interesting times because in early 2020, when the pandemic was declared, many of us vaccine advocates who are at the state level, really kind of hoped that this is what the world looks like and what the world feels like when we don't have a vaccine in place to be able to help control this infectious disease crisis. And so we were fairly optimistic. We knew scientists and researchers were working fervently to find a solution to help us all move ahead. And then, of course, when the vaccines became available, one, we should definitely celebrate the large swath of Americans who have gotten vaccinated with their first dose. We're at now almost 8 out of 10 Americans have at least one dose, and we still have quite a bit of ways to go to get them fully vaccinated, with all 3 doses. But also, a lot of concerns came up. For most of us, this is the first public health crisis to this scale that we've ever experienced. So there are lots of lessons learned, and also understanding that people have a lot of questions. And, while there is an urgency to get people vaccinated, I think we also have to recognize and have a little bit of patience with those who do have questions. At the end of the day, we want to make sure people have the right information. They have factual information when they're making those decisions for themselves and for their families. But, completely agree with, Congresswoman Trahan and Dr. Wen and I'm sure I'll, agree with Emily as well, that, we are, at some point going to have to transition to the acceptance of, this is we're going to have to live with COVID, and how do we operate and function within that space. But in the same time, continuing to ensure that we're nudging and we're encouraging people, to get vaccinated, the benefits of vaccination, and then also evaluating and determining what kinds of policies do we need to have in place at the state to help, move things forward.
Thank you so much, Reka. And then finally, I have Emily G. Emily leads the healthcare policy at the Center for American Progress. There, she advocates for reforms to expand coverage, improve care, strengthen public health, and advance health equity. Prior to joining CAP, Emily was an economist at the Office of the Assistant Secretary for Planning and Evaluation at HHS, and worked on implementation of the Affordable Care Act. She also served as a health economist at the Council of Economic Advisors in the Obama White House. Emily, thank you so much for being here.
Thank you, Ariel, for having me here today. We entered this new year with a surge in cases along with soaring hospitalizations. And besides the troubling experience of seeing family and friends around us fall ill over the past few weeks, I think this has been a wake-up call to us that the virus could be here for a while. Now, we're talking a lot about learning to live with the virus, but accepting that it could be here for a while doesn't mean letting it run rampant. At the same time, we know that we know so much more than we did 2 years ago about how to slow transmission, how to treat the disease. And with 250 million Americans at least partially vaccinated, we don't need to go back to stay-at-home orders or a constant atmosphere of fear. There is a middle ground, which is using the tools that we have to slow community spread, implementing policy to empower individuals to reduce risk for themselves and their families, and ensuring that the healthcare system capacity is there for those who need it. In terms of policy, I don't think it's possible to overstate that this is a really hard task. The Biden administration and policymakers at all levels of government need to make big, pivotal decisions based on preliminary science knowledge and a changing virus. As we think about the year ahead, I think there are two principles that should inform policy. First, policy intervention should be designed to make it simpler and less costly and more appealing for Americans to do the right thing. We need to make it so that the choice to support public health is the default for individual people. Secondly, the response needs to acknowledge that the pandemic has impacts for everyone, including the vaccinated, and needs to focus on community and not just individual health. Both the health and the economic impacts of the pandemic affect us all. The administration's initiative to distribute more than 400 million masks to the general public is also a big advance in this direction. And lastly, I want to say that another lesson that I hope we take away from this Omicron surge is the importance of preparedness. We all hope this is the last surge in the United States, but we shouldn't bet on it. We can't rely on markets alone to sustain stockpiles and production capacity for masks or tests or vaccines or antiviral treatments. There's real business risk for the private sector in stepping up production, and the government's role needs to be to absorb that risk and guarantee a market for critical supplies using policy mechanisms like advanced market commitment and the Defense Production Act to ensure that we have enough ready for a surge even when things are better. Good policymaking for public health means preparing for the worst, even if we keep hoping for the best in the year ahead. Thank you.
Thank you. I'm really excited to have you guys all here because you're all coming from such a different lens, and I think that that's important to consider. In recent weeks, there seems to have been a shift in thinking around COVID-19. The Biden administration has moved to expand testing and access to masks, but some of his own advisors have critiqued, though very politely, the administration calling for a new domestic COVID-19 strategy. And these experts seem to think we need to establish a new normal of living with the virus indefinitely. So with that as the starting point, Congressman Trahan, how do you think we should balance the trade-offs of a more isolated life where we're working remotely with fewer in-person events that is accompanied by depression, anxiety, substance use disorders, an increase in violence, and then the need to limit the spread of the virus to protect vulnerable people?
Yeah, no, it's a great question. And I am elated that the administration is taking steps, as they have adjusted throughout this pandemic, from vaccines to testing and masking. Look, the COVID-19 pandemic, the resulting economic recession have negatively impacted and affected many people's mental health. It's created new barriers for people already suffering from mental illness and substance use disorders. The CDC data indicates that more than 100,000 Americans died from a drug overdose from April 2020 to April 2021. That's a staggering number. And we know that there are flexibilities that have been put in place for individuals suffering from substance use disorder to access treatment during COVID. There are still too many barriers in place that make it difficult to access proper treatment. Additionally, look, the behavioral health workforce, as we are seeing across healthcare workforces, is experiencing a shortage in providers, further limiting access to care. So even with the embrace of telehealth and other innovative ways to access care, overall, the mental health crisis in this nation has just worsened due to COVID-19. And I think it's important to stress the fact that the single most important thing that we can do to return to normal, to help our small businesses, to protect our communities, to protect our mental health and realize a new normal, is just to get everyone vaccinated. The Omicron variant is present in each of our communities right now. I just attended a public gathering moments ago, and chances are I was in contact with the virus. At this point, it really is up to each individual to assess their own risk, whatever that may mean for them about this virus. But being fully vaccinated and boosted significantly increases protections from COVID-19, and it significantly decreases the chances of hospitalization and death. And the faster we get to that higher vaccination rate, the more we're going to be able to stop seeing surges on our hospitals, stop contending with kids sent home from school. I've got elementary school kids myself, and we will be able to not be living so much in isolation or in remote environments, and be back, sort of in community with others.
Can I add to what the Congresswoman just mentioned, because I really appreciate your mentioning about the other impacts that we've been seeing during COVID, the isolation, the stress, depression, and anxiety that children, working families, all people have gone through, the increase in overdose, addiction, the epidemic of obesity that was already a major problem, but has certainly not gotten better. It's only gotten worse, in part because of sedentary activity, and also in part because so many of our resources have been diverted away from other core public health issues. Emily, I think, had mentioned about the need to bolster public health infrastructure altogether, which is something that I cannot agree with more. But just want to add too that at some point we also have to recognize, look, we are in entering year three of this pandemic. Public health is not just about the absence of COVID. Good health for the individual is not just about not getting infected. It's also about other things. I mean, I see patients, and it breaks my heart to see somebody who is vaccinated and boosted and therefore at very low risk, especially if they're generally healthy, for severe illness, who is not seeing their family, who is not going to the gym, who is not going to all their normal activities because they're so afraid of COVID. And look, I understand why. I don't judge somebody else for their values, except that we also have an obligation to help individuals figure out how to balance all these different risks in their lives. And again, absence of COVID is not the only thing that they need to be weighing in their lives. If going to the gym is important for their physical and mental health, if seeing their family or traveling is important, there is risk, but there's also value in engaging in these other activities. One more thing I want to mention, and one of the reasons I've been so excited to be engaged with PPI in the past too, is that we have to be practical. Public health is about public trust. You're not going to get anywhere in public health if you're not meeting people where they are. As others have mentioned, that certainly is the case for vaccines, right? That when we look at vaccines, we have to understand why it is that people are hesitant to meet people where they are with compassion, but it's also meeting people where they are with their understanding of COVID. Even though right now, yes, it is very true that our healthcare systems are at the brink and there are many impacts to society, but there are also many people who have moved on from COVID and are not in the mentality of restricting themselves anymore. If we don't meet people where they are, then our advice will fall on deaf ears. And that's going to be a really big challenge if we have new variants arise in the future. So I am really in favor of peeling back mandates wherever possible right now, so that when we have a next variant or another public health emergency, we will have the trust to be able to put it back. We have to meet people where they are with their understanding of this moment too.
Thank you, Dr. Nguyen. Actually, I wanted to sort of build on that question relating to vaccines. So, traditionally vaccines were looked on very favorably as preventing disease. We can think back to like polio vaccine, where without mandates, people lined up to get the shot. And now, we're having such politicization of it that there's become almost like a partisan divide around vaccines. I was hoping, Rekha, you could talk a little bit about, how do we think about that, and how do we meet people where they are, whether it's people who are just vaccine hesitant or whether they're anti-vax, and how do we not lump those two groups together, and so that we can effectively bring people along?
Great, thank you. So there's a lot baked into that. I think, first and foremost, when you look at sort of the history of vaccines and the history of vaccination, people who have been hesitant, or people who are, very strongly opposed to vaccination, is really not new. I mean, we saw it, hundreds of years ago with the smallpox vaccine, when a lot of cartoon caricatures were kind of distributed at the town hall square about smallpox vaccines and what could potentially lead to that. And so it's not necessarily a new phenomenon. I think what has happened, obviously, is we've seen this acceleration in technology and how we share information, and the medium in which we share information is so fast, and it's so rampant that people are consuming so much information at a very fast clip, and also trying to discern which is the right information and which is not the factual information. I think the research is very clear that healthcare providers continue to be a trusted source when it comes to a person's healthcare, and helping them to make a decision that's in the best interest of themselves and for their family. And I think Dr. Nguyen said something really poignant, in that it's really important right now to kind of meet people in the middle. I think there's a small group of individuals and folks that are capitalizing on people's fears, and so that has led to this division that we're seeing, and trying to make vaccination a political issue. But it's the old adage that public health and infectious disease outbreaks have absolutely no borders. They have no borders in our neighborhoods, in our communities, in our counties, in our states, and across the globe. And so it's non-discriminant, and it's non-discriminant against, it doesn't pick and choose political parties. But I think what we have to sort of recognize is kind of coming back and meeting people where they are. And that includes having conversations. It's both listening and answering people's questions. And so, when we look at individuals who are vaccine hesitant, you're exactly right, in the sense that we can't assume that everyone who is hesitant, meaning someone's got a question about the vaccine, is automatically vehemently opposed to vaccination. That's not necessarily the case. It takes a little bit of patience. Asking really good questions, reserving opinions, and holding back, kind of your thoughts, and really trying to drill down to understand, where that origin of hesitancy is coming from, what is motivating them to not get vaccinated, or even what's motivating people to get vaccinated. I think there's a lot of insight into that. At the end of the day, people who are strongly opposed to vaccination, they're typically opposed to any vaccination, and they represent a very small percentage, of our overall community. What we really have to do is, be thoughtful and just have those one-on-one conversations with people to understand, where they are and help give them the right tools and the right information to, again, make that decision that they feel is in the best interest, for themselves and for their loved ones. Additionally, Dr. Nguyen mentioned, requirements. We have so many different effective public health tools in the toolbox. Requirements is one tool, but we have a lot of tools way before that. We're strong advocates in education. It is a longer cycle, but again, it's part of that building trust where you're listening, you're asking questions, and then you're giving, good pieces of information to help build out that story for that person. At the end of the day, when we're looking at and evaluating policies, we're trying to look at the entire continuum. What can we do to motivate and incentivize people to get vaccinated? And, it's sometimes taking a step back where we feel like we need to have the big stick in order to move people along, where instead we have lots of carrots available. And, we've seen that at various levels. We've seen it with employers who are giving, their employees some time off to go and get themselves vaccinated. We're seeing vaccine clinics coming to, very convenient sites. Those are all, small mini milestones that we can try to strive for and achieve to help move people along. There may be a point where we have to reevaluate all those different interventions and look at something that's more broader scale. But in the meantime, it is really kind of getting down to that micro level, doing some hand holding, we're all in it together to get people more comfortable and more motivated to ultimately get vaccinated.
Thanks for that. Something I always try and just remind myself to stay a little bit humble is that lots of purely rational people who quote unquote believe in science do things anecdotally all the time. Whether it's taking things to like boost our immune system or whatever, we don't always behave in rational ways. And so if we can sort of keep some humility when we talk about vaccine hesitancy and remind ourselves that we don't always behave 100% rational all the time, I think that can help, create a common bond and some trust. Something that I wanted to ask Emily about is, is there a appropriate place for, vaccine requirements or mandates? And how do we think about, when they are effective and when maybe the backlash against them is worse than the benefit that they create? How do we sort of think about those trade-offs?
Thanks for that question. I believe vaccine mandates are a really important tool that we have to get people vaccinated. That said, all the tools that Rekha just talked about, incentives, access to better information, paid leave to get vaccinated, and also recover from side effects, should be implemented in conjunction with vaccine mandates. I think it's important that we, have this, give people a really strong nudge to get vaccinated, but also keep supporting them and understand that that people might lack information or don't feel like they don't have time off or are concerned about missing work, and be non-judgmental about those who still remain unvaccinated. That said, we know from the evidence that vaccine mandates are very effective. United Airlines was one of the first companies to have an employer vaccine mandate, even before the Biden administration's OSHA rule, which was struck down by the court, which is a huge setback. But even before that rule was announced, United Airlines required all its employees to get vaccinated, and it had a 99% compliance rate, which is terrific. And during this past Omicron surge, because it had such a high vaccination rate among its employees, they had a really, really low rate of illness and, fortunately did not have any deaths among their employees. Fox News is another organization that mandated vaccination, had 90% of their employees get vaccinated when they, had an announcement about that. New York State also successfully implemented a nursing home vaccination mandate to go from 75 to 92% within the first month of their mandate to help protect nursing home residents and nursing home staff. So these mandates do work. And this is not a new concept. The Supreme Court's first case upholding a vaccine mandate was back in 1905. We all know from either our own experience or if we have kids that childhood immunizations are required for schools and also among colleges and universities, which I think is one reason why we've seen higher ed institutions at the forefront of requiring not just vaccines, but also boosters for attendance.
Thanks for that. I was thinking, jump in.
Could I piggyback on what Emily was saying, which is, 100% agree with everything that she's saying. I think, one of the things that we have to be mindful of, and again, I'm kind of looking at it from a state perspective, is we want to ensure that we've got all those tools in the toolbox available, whether we use one, whether we use all of them. And I think, what we saw last year, looking at state legislatures across the country, I keep tabs on, the kinds of legislation that's getting filed in state legislatures. And, of course, over the course of 2021, we saw over 1,300 vaccine-related bills filed in state legislatures, and it was the gamut. There were legislation to help continue to move, and build up the local or the state, vaccine policy infrastructure. But over half of those bills were actually, anti-vaccination, whether it was related to COVID or whether it was related to other vaccinations that would ultimately break down, the policy infrastructure and then potentially decrease vaccination rates. And some of those, pieces of legislation wanted to remove those kinds of tools from the toolbox. And so I think it's really important to recognize that, we cannot be premature in any of this, especially when it comes to policies, because there are knee-jerk reactions, because there's this impetus to make it political. Decisions are being made to say, wait a minute, no, we're gonna prohibit employers from requiring vaccines. We're going to prohibit schools from doing that. Again, to Emily's point, we know over time those kinds of tools like requirements have been effective. We may not have to implement that, but we shouldn't also have this reaction where we remove that from the arsenal of public health officials, and then have to find alternative ways and slower ways to get people vaccinated.
Can I add to this? Because I am a strong proponent of vaccine requirements, and I want to make the case for why from a public health standpoint. There's been, I think, an unfortunate narrative that's built that vaccines protect you against severe illness, but they don't do much when it comes to protecting you from infection. That's not true. It is true that the primary reason for vaccines and the most important reason for them is to prevent you from getting hospitalized and dying, right? I mean, that's really important. And that's a tool that we did not have even last year at this time widely available. And COVID was something that was really feared because people thought that they might die if they get it. I mean, it's wonderful to take that off the table for the vast majority of vaccinated individuals because they won't die now that they're vaccinated. That's great. But we also know that individuals who are vaccinated are 5 times less likely to contract COVID compared to somebody who is unvaccinated. That difference is more pronounced for individuals who are vaccinated and boosted. Having that third dose reduces the chance of symptomatic infection, not just severe illness, but infection compared to somebody who is unvaccinated. I have a lot of people asking me, what's the point of getting vaccinated if I'm still going to get COVID? But you're 5 times less likely to have COVID compared to somebody who is unvaccinated. Other people will use that same argument because, look, breakthrough infections do happen. But why do they happen? I think of the vaccine as a very good raincoat. It's protecting you well when there's a drizzle. But if you are in a thunderstorm all the time, at some point you're going to get wet. The reason why we're having breakthrough infections isn't that the vaccines aren't working. It's that there is so much virus around us. And that's the reason why at times of high viral transmission, you also need a mask. You also need testing. You also need these other layers, ventilation to protect you. But it doesn't mean that there's something wrong with the vaccines. And to this point about why do we want vaccine requirements in a workplace or in a school, it's not because we just somehow want, it's often framed as control or power, and the government is making you do something. No, they're trying to ensure workplace safety. If I have to be in a room shoulder to shoulder with people for 8 hours a day, and I have to choose whether I want them to be vaccinated or unvaccinated, if I know that someone who is vaccinated is 5 times less likely to have COVID compared to the unvaccinated person, of course I would rather be in a room with people who are all vaccinated. That said, I very much take the other points that have been raised about could vaccine requirements backfire? And I think there is a school of thought that now we're seeing the backlash, if you will, to vaccines bleed into other immunizations. And that would set us back so many years when it comes to other routine immunizations that we have long accepted. So I am in favor of, in a sense, thinking of vaccine requirements like we think about the Easy Pass, or thinking about this as the TSA pre-check line at the airport, that everybody can still go to work or go to school or whatever the case is. But if you are unvaccinated, maybe you have to be tested on a regular basis. Maybe you still have to be wearing a mask. But if you are vaccinated, you can opt out of those things. To me, that's a much better way of framing it. You're not really restricting people from doing something and saying you have to get vaccinated. You're saying we are all for workplace safety. A workplace that doesn't have testing, masking, or vaccines is unsafe. So you need to have some of these elements. But if you have testing and masking, you can be unvaccinated. But if you're vaccinated, you can opt out of those other things. I think, to me, that's a better policy framework going forward.
That's such great framing around that. And something I was thinking about what Emily said about boosters, and I wanted to turn to Congresswoman Trahan. We're living in this world where the evidence is constantly changing, and I think that's really difficult for policymakers. And so how do we think about policy decisions, whether they be boosters or quarantine requirements and all these things, as we're living with incomplete data and in an evolving situation?
Sorry about that.
No worries.
It was bound to happen. No, it is it's a great question. And I think one that we're all thinking about sort of on the fly as we go. Of course, we're all talking about pandemic preparedness, trying to wring out the lessons of, where we could have been better prepared, from the start of COVID. And then we're noticing that we have to adjust in real time because of variants. The CDC has had to update its guidance throughout the course of the pandemic as new data has become available and as the virus has changed. No data set is perfect. We always need to make decisions based off of an imperfect picture. Public health analysts are learning ways to pair quantitative data with qualitative data. Healthcare workers, community leaders, they all have stories and information about what this vaccine rollout looks like on the ground. That is valuable information and can highlight gaps in traditional sort of data sets, how we think about. I have a number of initiatives focused on increasing researcher access to data. I'll give you one example. I have the Social Media Data Act, which would give researchers, independent researchers, academic researchers who study the way health information spreads online, access to data currently locked inside of our large companies like Google and Facebook. My office has been working and looking into the ways that gaps in medical data on diverse patient populations is leading to discrimination in medical software applications. And, this is an issue I hope the Pandemic Preparedness Caucus, which I co-chair, can address, because we have technology available to make public health data sets more complete, accurate, and shareable in a way that protects privacy. And we need to do better in the next emergency. And frankly, we need to do better as we respond to this one.
That's so interesting. Obviously, having data silos, whether it's health insurance information or public health data, or, just a decentralized healthcare system, has become a hindrance in this situation when we're trying to respond so quickly with incomplete information. Emily, I wanted to see if you had any thoughts on rapid testing. Speaking from my own experience, which is anecdotal, obviously, I was symptomatic and took multiple rapid tests and they were negative. And so I thought I must just have the flu. It was over Christmas. I didn't infect anyone, but on Christmas Day, I decided to take another one and it was positive. And by that point, I was already on the mend. And so, I'm thinking about how do we think about testing and our testing strategy if rapid tests are catching infections as early as they were with previous variants. I don't know if
That's
you have any thoughts on the issue.
Yes, and I think it also relates to your previous question, thinking about how do you make policy decisions with tools, based on incomplete information, or even having tools that might not be 100% perfect. And I think, this highlights an area where we could use some better, clear science communication about what tools are out there and how we use them. I've heard from, not just your question, but other families and friends who've said, but I've heard rapid tests don't work. And I think that shouldn't be the actual takeaway. It is true that rapid tests are less sensitive than a PCR or viral test, but they are still really important tools for public health. A rapid test generally is a good sign of whether you right now are infectious, and they can be used for public health to support surveillance, to reduce transmission rates by having people say test in the workplace or test at school, and they can also help us reduce infections, which then lead to cases of hospitalization and even death. So I think it's really important that throughout the pandemic, we not let the perfect become the enemy of the good. I think this also happened to us with masks initially, where in addition to the problem of not having enough medical grade masks for healthcare workers on the front lines in 2020, there was also a lot of concern about, general public maybe shouldn't wear N95s because they can't ensure a good fit. Now we know that particularly for Omicron, it's really important that people upgrade their masks, that surgical is better than cloth, and that KN95s are better than surgical procedure masks. And the N95s, even if you don't have a perfect, the perfect fit that you might need for a factory or for a hospital, that provides general public with better protection than the cloth masks that many of us had been wearing for the first couple of years of the pandemic. So, that's it. I think as far as testing, I think this is why we need to have continued government involvement and preparedness, whether that's, continuing to ensure that we have stockpiles and data infrastructure to support response, but also having a government that will respond quickly if we need to modify, say, the formulation of the vaccine in the future, or modify the type of test that we have on the market.
That's a great point. And then I just wanted to end our discussion, maybe I could get everyone's thoughts, starting with you, Rekha, on, going forward, what are the lessons of COVID-19 and how can the US be better prepared for the next pandemic, particularly if it isn't a respiratory virus?
I think, one of the biggest takeaways is clear, concise, and as transparent communication as possible right from the very, very beginning. From the start of the pandemic, we had a lot of disconnect in terms of the kinds of communication and the quality of communication that was being pushed out to the general public. Allowing our public health experts to be the primary guiding voice. I mean, they've spent their careers, understanding these kinds of issues and preparing for some, and then others that we're kind of learning as we go along. But really, elevating them as the trusted source and the voice. And so I think coming away from this as we're kind of taking stock of everything is being as forthright and truthful with the public, and in some ways also acknowledging that if we don't have the answers, or if they don't have the answers aren't there yet. But hopefully they're coming. And I think that is a pill that, while we may not want to necessarily swallow, I think we can swallow, and not holding back information. I think that's intentionally, unintentionally, regardless of the case, it's just being as forthright and as simply communicating the issue to the public.
Thank you. Emily, do you want to have your closing thoughts next?
So I think a couple of lessons that we need to take away are, one, echoing that the importance of preparedness and not letting down our guard when things start looking up. We need to prepare for the worst, make sure that we replenish the national stockpile with the things that we might need, ensuring that production lines are ready to, are there and ready for a COVID surge, but also thinking in the long term about ensuring that we have better systems for surveillance, and that we're going to have institutions in place that will allow for a more nimble COVID response or a pandemic response in the future. And then secondly, I think we can also look to the rest of the world for lessons on what's working and what's not working. And I think, early on, we saw a lot of countries in Asia that were doing a really good job with contact tracing and testing, and also mask wearing, that have key cases down in those places. And those should have been instructive.
Dr. Wen?
I want to agree with what Rekha and Emily just said. I am also just want to put an additional note on the importance of transparency. There has been a lot of trust lost in this response, initially because the previous administration did not listen to scientists. And then, unfortunately, this administration has also had a number of missteps around messaging, and prematurely initially dropping mask mandates, then muddled messaging on boosters, and now the latest confusion around isolation. I think it comes down to having an explanation of why policy changes are occurring. We understand that in the middle of a pandemic where there's a lot of new science emerging, new policies, new ways of understanding things, that there will be change. But it's important to understand if the changes are made because of new science or because they're made due to some other factors, which are understandable. For example, if the isolation guidance, the shortened isolation guidelines were explained as our essential workers are not able to come to work and we're going to have a total collapse of our healthcare system, that's the reason why we need to shorten the isolation. That would be a lot more understandable than we're just going to do it, and it's unclear that it's actually evidence-based. And so I think having a better way of communicating to the public, explaining why decisions are made, will be essential to restoring a lot of trust that unfortunately has been eroded. One last thing I'll say about this is COVID has certainly unmasked a lot of issues. It didn't create health disparities, but we have certainly seen health disparities play out in a way that may not have been apparent before. COVID did not create the issues around social determinants of health and how health is interrelated to so many other factors, including food and housing and so forth, but it has unveiled them. And so I hope that we're not going to let this crisis go to waste, in the sense that we will have seen the problems in our healthcare system and the lack of investment in public health writ large, and there will be renewed attention to focusing on these issues in time to come.
Thank you. And Congresswoman Trahan, any closing thoughts?
Yes, I mean, I'll echo what all the panelists have said in terms of lessons learned. I mean, look, the politicization of public health and our response to COVID has cost lives, right? I think we have an obligation to work together to ensure that nothing like this ever happens again. I mean, we can't afford to get flat-footed. Back in March of 2020, very early on in the pandemic, I co-founded with my Republican colleagues as well, the Pandemic Preparedness Caucus, to ensure that, we achieve that goal. I mean, I think a couple of things that we recognize is the need for a permanent testing infrastructure and a capability to ramp up whenever necessary. We recognize that we need a strengthened public health and medical workforce, both keeping current medical professionals who are feeling the burnout and as well as bolstering the pipeline of infectious disease specialists who have proven essential over the past 2 years. And I think finally, we recognize that we have to build consensus to achieve those goals, in our communities on the ground with bipartisan solutions in Washington, because that's what this is going to take to solve, the glaring problems that COVID has highlighted and exacerbated.
I think it's safe to say that we're definitely all sick of COVID, but obviously it's the reality that we're living in. And so I just think it's so important to consider, what the US got right, what we got wrong, and how we can prepare for the future. And I thank you all, my panelists, for participating today and giving your insights and expertise. You can find them on Twitter at Rep. Lori Trahan, at Lena Wen, and Emily _DC, as well as at immunize_USA. And then I'm on Twitter at Ariel Sophia. Thank you everyone so much. Have a wonderful afternoon. I hope everyone stays healthy.
Thank you.
Thank you.